Hello everyone, and welcome to the Let's Talk series episode 4, organized by Aesthetic Medicine India and powered by Galderma. One of our most recent introductions, the Let's Talk series, was launched last year. We have had subject matter experts and experienced aesthetic medicine practitioners join us as eminent speakers with our first episode on personalization with Restylane Define, followed by our second episode on lip fillers, our third episode on achieving radiant skin with original skin boosters. And today we welcome you all to the fourth episode of Let's Talk on bright eyes with Restylane. I am Shriyal Sethumadhavan, the executive editor of Aesthetic Medicine India. And on behalf of the Aesthetic Medicine team, I would like to thank our partner Galderma, our guests, our speakers, and our viewers for joining us today. So what's the Let's Talk series all about? Organized by Aesthetic Medicine and powered by Galderma, every episode of the Let's Talk series brings together two aesthetic medicine practitioners to discuss an aesthetic treatment along with case studies. Aesthetic Medicine was founded in the UK 18 years ago. It is the original B2B business magazine in India for discerning aesthetic professionals. I would say the magazine is a must read for medical practitioners such as dermatologists, clinic managers, plastic surgeons, selected aestheticians, and cosmetologists. The Aesthetic Medicine Expo and Conference was introduced in India in 2019 with the aim of connecting the medical fraternity with the supply chain stakeholders and providing a platform for networking, sourcing, and training. Then came 2020, and since the world was besieged with the pandemic, we at Aesthetic Medicine took the challenge and set ourselves on an exciting digital journey. In all success, the Aesthetic Medicine digital series were introduced, and our webinars and online interactions with experts have been instrumental in bringing vital information to practitioners on various treatment and discussions revolving around different subject matters such as practice management and various indications. I am also delighted to announce that we are gearing up to bring back our physical event in Mumbai, something that we all have been waiting for, rebooting the India aesthetic medicine industry. The Aesthetic Medicine India show will be a blend of an exhibition and panel discussions among India's leading dermatologists. This will be held on May 29th this year at the St. Regis Hotel in Mumbai. More details are available on our website. You can log on to aestheticmed.in. I would also leave it for you in the chat box. You can follow us on our various platforms, be it our website, our YouTube channel, Facebook, and Instagram. The key to search for us is Aesthetic Medicine India. So today's webinar will focus on bright eyes with Restylane. And before I detail the topic and introduce you to all our eminent speakers that we have with us today, let me present to you a video from our partner Galderma.
Designed to allow you to be your naturally expressive self. So go ahead and laugh. Smile. Smirk. Frown. Or smooch. Because maintaining your natural self-expression is worth it. Worth every expression.
This video is a patient education video, and you can contact your local Galderma representative to install the video in your clinics. So in today's Let's Talk series, episode 4, we have Dr. Kiran Hebalkar, cosmetologist and dermatologist, Kiran's Clinic, Mumbai, and Dr. Shireen Y. Punawala, dermato-cosmetologist, trichologist, and laser surgeon, Skin Vibes, Pune. They're going to be talking about the go-to solution for under-eye brightening and teardrop correction. Introducing our speakers with a few more words, Dr. Kiran Hebalkar has an MBBS degree from Amravati, along with DDV from Mumbai University. With extensive training and learning with prominent dermatologists of the country, she set up Dr. Kiran's Skin Clinic in Mumbai. She has a great deal of knowledge in prescriptive and interventional skin and body care. Her specialized field includes anti-aging treatments such as fillers, neuromodulators, scar and pigmentation treatment with advanced treatment and laser treatments. She has attended various national and international congresses. Dr. Kiran, you could get your video on. Thank you for joining us. Also, please welcome Dr. Shireen Y. Punawala, a dermatologist and cosmetosurgeon based out of Pune. She passed her CPS diploma from KEM Hospital, Pune, and has been in private practice since the past 10 years. She is a consultant dermatologist at Inamdar Multi-Speciality Hospital in Pune. Her special fields of interest includes energy-based devices in various indications in aesthetics, hair restoration, and anti-aging treatments ranging from EBDs, botulinum toxin, fillers, and thread lift. I now request Dr. Kiran to take over. For our attendees, we would first begin with a presentation that will be made by Dr. Kiran. Then we would follow with discussing their case studies on today's topic, which would first be done by Dr. Shireen, followed by Dr. Kiran. And the third part of today's webinar will be an open discussion between both doctors, which of course they would have their detailed discussion. And then we would be very happy to refer and respond to any of the questions that you may have. We have 45 minutes for the discussion, and then you could follow it up with the Q&A from the attendees. Just for all my attendees here, you would see at the bottom of your screen, we have a chat box. You could please put in your questions for the doctors in the chat box, and we would, in best interest of time, try to respond to as many questions as possible today evening, but please do keep it going. With that, over to you, Dr. Kiran, to take it forward. I'm going to share my screen with the presentation, and you could take it ahead from there. Is the screen visible?
Yes, yes.
Yes, Dr. Kiran.
Yeah, so good evening, dear colleagues and all the doctors and attending the meeting. Thank you, Galderma Aesthetic Medicine, for inviting me to talk about my experience on the bright eyes session. See, when we consider eyes, it's the first part on the face which starts aging comparatively faster to other areas of your face. And treating the peri-orbital area is very challenging because the skin around there is very thin and it's more prone for fine line wrinkling, and there's less collagen. The elasticity is disturbed, and we tend to have sagging of the skin. The pigmentation around the skin of the eyes also matter a lot. The vascularity in that area makes difficult for the treatment. And the last is the eye bags and the sagging which comes because of the weight loss, age, and the laxity of the ligaments. Adding to that are different lesions which are present, like xanthelasma or skin tags around the eyes, which make the treatment more modified way, so we can achieve bright eyes and give you a fresher and a better look to your the face. So for us, we talk about the Galderma Aesthetic Collection, which has relax, refine, and refresh for the different part of the face. So we can relax our muscles by using Dysport, which is a neuromodulator. And we have define, which can be done by lift, fill, and volumizing by using different products like Restylane Lift, Restylane Define, Restylane Volume, and Restylane Ties for the lips. For refreshing the skin, we have Restylane Skin Boosters, which are very good for hydrating the skin, improving the quality of the skin, and giving a nicely hydrated, a plumped up, and a refreshed look. Next slide, please. So as we all know, it's of a Nasha technology, which is like a high G prime, and the gel which is formed is very firm, so that there is a uniform size of the particles. You can keep rolling the next slide. Shali, next slide, please. So which has a cross-linking, which is less than 1%. So it is easily moldable, and it can be easily reversible if you have any problems with the filler. So it can be easily hyaluronidases can be used to treat and reduce the fillers. And the gold standard HA filler for treating tear troughs, nasolabial folds, lips, and perioral lines is Restylane, which works beautifully and doesn't give you a plumped up or heavy volume. So it gives you a even contour and soft look to your the sensitive areas of your face. Next slide, please. Sharil, next slide. So as it's mentioned, like it has NASA technology, which has the cross-linking, which is less than 1%. And the NASA technology gives Restylane a firm gel texture, which has low flexibility. This prevents the distribution of the filler into the surrounding tissue after injecting, and for lasting aesthetic results, so that when we do any filler under the tear trough, so the product doesn't get compressed to the surrounding areas, and we don't get too much hydration and volumization in that area where we want a softer and a natural look. Next slide, please. Whenever we have done Restylane, we have always got a very good satisfaction. Usually once they have done, they always come for a touch-up. And after the second touch-up, we usually find that the results are much more lasting, and they are more natural and beautiful looking results. So Restylane is, we have lift, we have volume, we have define, guys, and the skin boosters like Butan. Next slide, please. So before starting the bright eyes, definitely we need to talk about the important points on our face, which is the ligaments, which we need to work around the ligaments. Usually these are the ligaments which lead to the tear trough. It's related to orbicularis retaining ligament, which causes the sagging around the periorbital region, and the zygomatic cutaneous ligament, which causes the development of nasojugal groove. So whenever we are treating tear trough and we are injecting on the orbital rim, we are supporting the orbital retaining ligament. And when we are doing the mid cheek points, so we are targeting to treat the zygomatic cutaneous ligament, so that it gives the support to the mid cheek and then to the orbital rim. So then we can attain a complete rejuvenated skin, and the results are much better if we target treating the under the ligaments, so that we support them. And the most important part is keeping the vascularity in mind. We see the facial artery, which comes near the nose and becomes the angular artery. So if we are not too medially to the medial part of the face, we shouldn't be worried about the vessels. But then we always do a markings of lateral pupillary line, mid pupillary line, and the medial. So we always try to inject away from the medial pupillary line, not going medially. So the best way is to target the orbital rim and be lateral to the mid pupillary line, so that we are not getting in the field of that intraorbital artery. So these are the two important vessels we need to keep in mind while injecting. Next slide, please.
So now, Dr. Kiran, we'll move on to the case studies from here.
Yeah.
And we would have Dr. Shireen join in as well. And yes, over to you all with the case studies. Dr. Shireen, I believe the first case study is yours, so you could start from here.
So very good evening to all of you, to my dear friend Kiran. A big thanks to Galderma and Aesthetic Medicine to give us this opportunity to come here and discuss such an interesting topic, which we all want to learn and become experts in, because periorbital skin rejuvenation is a very common indication, and we have many patients coming to us for the same. So we begin the session by discussing the first case, So she's a 35-year-old female patient who came to me with this complaint of hollowness around her eyes. And on a closer examination, I found something amiss with her face. So on history taking, we realized that she had done a Botox. So we can see spocking in the right eyebrow. Overall, the skin was a bit photo damaged. How we progressed with the treatment was to give her first a good skin rejuvenation treatment, with advice to use sunscreen and some topicals. And to address the hollowness, we advised her with filler treatment. And also the correction of the spocking was done using neurotoxin. So for this case, the way I approached is first by targeting as Dr. Kiran very clearly explained to us, by supporting the ligaments, so supporting the lateral ligament, the zygomatic ligament at the cheek, because we also see some ptosis of the mid-cheek and prominent nasolabial fold. And by doing that, we also helped her in reducing the roundness of the face and giving her a more V-shaped appearance, a more slimmer appearance. And then the refinement, so this was performed using Restylane lift, and the refinement was done with Restylane OBT. And I would like to ask Dr. Kiran how you would have approached this case.
Yeah, Shirley. See, after seeing her face, definitely we think that there is volume loss in her mid-cheek, and which is giving a sagging look to her, and there is a lot of pigmentation, and the skin around is looking, the picture is not so clear, but definitely there is a lot of pigmentation, and there is a sagging and might be like slight tear tuft, and she has an extended nasojugal groove also.
Yes.
So definitely we work on her quality of the skin, like what you mentioned with the energy based devices, peels, and we need to first target her mid-cheek so that we stabilize the ligaments, zygomatic cutaneous, and then we work. First, we start with the mid-cheek, and then we approach to the orbital ring, because that will help to reduce the volume correction in the periorbital region, and it will give you a better result.
Absolutely. So now can we have the after picture? So after the treatment, with this treatment plan, this is what we achieved. And this was very quickly within 15 days, where we achieved slimming of the face, a more V-shaped appearance. There is refinement of, the hollowness of the periorbital region has improved. The mid-cheek ptosis has reduced, and the nasolabial fold prominence has gone down. The patient was very happy with it.
Beautiful result.
Thank you. So we can move on to the next case now. So she was a 45-year-old lady who was the principal of a school, and because of lockdown, suddenly with sudden bombardment of online things and being the principal, she had to organize everything. So within 6 months, that's what she told me, that this was the damage her skin faced, and she had a lot of photo damaged skin, as you can see. And also there is rounding of the face, and there is again prominent nasolabial folds with very prominent ear trough grade 3 and nasojugal groove also with some melisma. I think it's not very clear on the picture. So Dr. Kiran, if she had come to you, how you would have handled her?
See, the pigmentation in this female is really difficult, because the nasojugal line, even if you correct with the fillers, it will still stand out. It will not go away. So she'll not be happy with the fillers correcting directly. So we need to work on her skin quality by using the combination of creams, good moisturizers, sunscreens, good skincare routine. And then my favorite treatment for such type of pigmentation would be like a Q-switch laser combined with PRP, which has done really a good, given a good result in a couple of sessions. So once you improve the quality of the skin, the pigmentation, and then definitely you go in for mid-cheek correction and the periorbital. But in her case, I think the periorbital, if you do hydrating fillers, which will be more like skin boosters, will be a better improvement, because the skin is quite fine wrinkling is there. So, and combination of lasers also, like erbium or CO2 laser can be done before filler, so that you improve the quality, improve the strength in the skin, and then you correct with the fillers. So this would be my approach.
Absolutely. Thank you so much. And we can have the after result now. Yeah, so here, as you can see, this is just within a week, and she came back very happy, saying that people are complimenting her that she's lost weight and she's become slimmer, though she's done nothing for it. So just by using the fillers, we have achieved this look where she's looking more youthful, the hollowness around her eyes, and even the texture around of the skin around her eyes. So this is pure magic of hydration of the filler, where in fact, after this, when we started working more on her photo damaged part of the skin, but just by fillers alone, so much of, that hollowness has gone, and the pigmentation suddenly has just disappeared. There's tremendous change in the skin texture also, just because of the hydration hydration of the Restylane OBT. And in this case, I also, we may not be able to see temporal hollowing here, but she had temporal hollowing. So by supporting the temporal fossa, we achieved the slimming of the face and were able to give her an oval look as compared to the round look before the treatment. And after this, we followed it with a very good skincare. And for the further sessions, then we did PRP for her periorbital area, which gave her a very good response. So she was quite happy with this sudden slimming that she achieved, in 15 days. Okay, so we can move on to the next case. Thank you. Okay. So she's a young 30-year-old female who's she was very high in the corporate ladder. And again, because of lot of screen time and all that, I think the picture quality is not very clear, but she had very prominent under-eye bags. So that was really bothering her. And somehow she was not happy with the way she looked. So on close examination, I found, like, of course, very prominent under eye bags, puffy eyes, then there was tear trough and nasojugal groove. Also, the skin quality was a bit damaged because of the high screen time that people have been facing for past 2 years, but corporates always have this high screen time issue. So again, back to you, Dr. Kiran. How would you handle this case?
Seeing her skin looks more of like a dry and pigmented one, and the picture is not so clear, but you need to add the skincare routine, which will give her more hydration and SPF, so that she improves the quality overall in her face. And since her eye bags are more prominent, definitely we need to target the mid cheek first. And in such cases, sometimes I have worked with HIFU also. Those candidates who are not willing for like fillers on the first go, when we do high intensity focused ultrasound, so it improved because she has a typical sagging on the jowl side. So for young girls who are not so keen on fillers, I have done maybe 1 or 2 sessions 6 months apart, the HIFU, which has given a good volume reduction in the lower face of the face, like improving the jowls. It has improved the mid cheek part also, and there's quite considerable reduction in the eye bags. But then you don't get 100% correction like how you can do it with the fillers.
Yes.
But those who are really scared to start with injectables and who want to get into like improving the face and the sagginess, so I would always suggest to go in for radio frequency or hypo, since radio frequency needs couple of sessions. Hypo will need one session, and you can, because everyone is busy these days, so can't come regularly. So I would suggest hypo for 2 sessions. Once that collagen building is there, the volume reduction is reduced on the lower part of the face, then you start working on the mid cheek and then correct the tear trough.
Yes, so absolutely right. For her, the first thing that I suggested for her was hypo because of her very prominent jowling and the eye bags. But she, on the other hand, wanted a quick fix. You know, she did not want to wait for 3 months for the results. She said, first you have to fix my under eye bag. She was even willing to, you know, go under the knife and all that. I said, okay, just hang on. And we began with filler. So in this case, I approached with again her temporal the hollowness, you know, so we gave support. So that kind of really helped her in her jowling. Then we gave her Restylane lift. We used the Nasha technology to strengthen her, support her from the zygomatic ligament. And the mid cheek filler we did, like to in the deep fat pads, you know, because there's a lot of the deep fat pad loss in a medial cheek. And then the refinement was done with Restylane. That was the final thing, because when we do all this supporting act, the supporting of the lateral face, that itself reduces the problem by 50%. So a week later, we can have the after pic when she came for her follow-up. She could not come, so she just sent a picture. And the picture is not very clear, but there was complete resurfacing of her eye bags. We didn't touch it. We just worked around it and all the support and all. And as you can see, even in this bad quality picture, we can see that the jowlings have reduced. And she's got a more, instead of a box-like face, it is more like an oval face. And after this treatment, we followed it up with neurotoxin injections for her masseters. So that kind of gave her a considerable improvement. So this is just like a week later, the results.
Yeah.
And
Excellent.
she was quite happy with that.
Excellent.
Next slide. So I guess she is Dr. Kiran's patient. So can you please elaborate and take us through this?
Yeah.
Case?
So, Dr. Shane, this is my young female who is in early 30s, and they are like in televisions, and they are constantly facing the camera and the light, and there are so much of stress of losing, not to gain weight. So they tend to, some people, they tend to lose fat more on the face. So she always used to get the sagging in the cheeks and the periorbital hollowness. For her, I started with the Restylane. Because her concern more was the periorbital thing. So we started, and her budget was also a constraint. So we targeted first the periorbital thing, and the second session we convinced her to do the mid cheek also. The first session we had done with the cannula, and because we needed to reach to the medial part of the tear trough. So I always feel comfortable going very close to the medial part of the tear trough with the cannula, and the rest of the part was done with the needle on the bone, the bolus technique. And she always comes like 6 months apart. She just does a little touch up, and she's happy because the results are then very well maintained, and it doesn't go back completely. So this was my approach, and how would you like to comment on?
No, definitely. I think this was the right approach, because she's a young patient and has very good cheek prominence. So I guess we don't need to add more over there. It's just like grade 2 tear trough, and wow, this is awesome result. So this is like after how many sessions and how many
2 sessions.
mLs of 2 sessions.
So
Okay. And how much
first session,
product was used?
first session was 1 ml only, and then the second one we did immediately after 6 months, and now still the results are very well maintained. So it's almost a year that she's not yet come back. And her comment was that after the second session, the results have stayed quite long, and she was like quite happy.
Yeah, I agree with that. There is that biomodulation which happens,
Yeah.
so there is a lot of collagen remodeling that keeps happening even after, a couple of years after the last filler treatment. So yes, that's true.
Yeah. So next slide. Again, this is young girls who she must be in her 20s, late 20s, around 24 year, and they usually go to college and they're studying, and they always feel that there is a shadowing effect and there is a volume loss. So for her, in her case also, we worked on her counseling session for like improve the sleep, eating habits, and we did few peels, and then I worked on her theater part with the Restylane only. No, there was no mid cheek correction or anything. So we just did the periorbital bolus technique, and within one session only it improved her the orbital region. Your suggestion for something like this?
Yeah, I guess in a young patient, and definitely we can always work on the skin also. And in a young patient, as you said, the lifestyle changes, which are very rightly advised here. And the use of regular sunscreen, because, screen time of these youngsters is very high. So that leads to a lot of photo damage and collagen loss. So yes, definitely. Wow, this is fantastic. Very natural looking result. And a lot of freshness around the eyes. So this is using 1 ml of Restylane.
Yeah, only 1 ml.
Fantastic.
Yeah, next slide, please. Shri, let's.
Is this
So this one?
Yeah. Okay.
Yeah. Dr. Shirin, would you like to comment how you will address this patient?
Wow. So she looks like a middle-aged woman, I guess. And looking at the loss, there is bone loss, there is tissue loss, there is fat pad loss, and there is a lot of ptosis of tissue everywhere. So I guess the first thing that we should do is, again, the topicals advice. That should be the basic routine that we have to instill in them, the daily care. And depending on how quick the results they are looking at, if they want a quick fix, then we can directly jump onto the filler treatment. But if they are fine with going slow, then we can, wait and do some PRP for this. I would really like to do platelet-rich plasma for her periorbitally because of the wrinkling and the loss of the photo damage that we can see in the periorbital area. And definitely fillers for the cheek enhancement to give support, and the tear trough treatment using fillers again. But I guess her requirement will be high. And we also have to give her support laterally because there's bone loss, which is very clearly visible in her zygomatic prominence. So support laterally, filling medially, and then finally contouring periorbitally would be my approach for her.
She was like a 55-year-old female. Some wedding was there. She had come only for 1 day, and she comes once in 6 months to 8 months. So I've just treated her twice. And for the first time I saw, it was like a temporal hollow, which was making her like very sick and old. So I said, the rest of the things we'll do later. First, we'll treat your temporal hollowness. So we did the volumization in the temporal hollow. So it was almost like 0.7 ml we had injected in each of the temporal fossa. And then I came to the mid cheek area where we treated her, corrected her the sag with supporting the zygomatic ligament. And then centrally I came and targeted the teardrop. And definitely I gave her some creams which were more of stem cell repairing and the retinol based, so that to improve her quality of skin. And the second time she came, so it was not a major thing. I had just to correct her little sag which always comes after 6 months, correcting the mid cheek and improving the under eye skin with skin booster. So that really worked well. After that time, I didn't touch her temporal hollow, so it was still good. So this was my approach. I couldn't do any energy base or the peels or anything because she was here only for 2 days. This was my
Wow,
result.
this is fantastic. So this is after how many sessions, and
This
what
is
was the product?
so the volume we had used for the temporal hollowness, and then we had used the lift for the zygomatic cutaneous, and then again define for the mid cheek, and the Restylane for the under eye thing. So this was the combination thing, but it gave her a immediately good hydrated look, and
Yes.
it improved the tired look, like
Tired look
so,
goes away, and a very
yeah.
lifted look she has got. Yes,
Yeah.
definitely a lot of youthfulness that comes
Yes.
immediately.
I couldn't take full pictures because I have not taken consent of the patient, so it was really hard to
Very
manage.
true.
Yeah.
Very good results.
So this is again a young girl around 28 year of age, and again they start losing the dieting, like intermittent fasting, and this the first thing they see that the under eye hollowness. This was also treated with one syringe, 0.5 ml, 0.5 ml on each side with Restylane, and it was like a one setting job, and it was, you can see the results.
So this is classic teardrop,
Yeah.
grade 1.
Yeah.
Wow, superb. Very natural looking and smooth contouring has been
And
achieved.
these pictures are immediately. So once they go home and then
Yeah,
hydrate,
it
it's
really
better
improves
result.
as it blends into
always
the
so.
tissue.
And it's always better to undercorrect the eyes on the table and then see it after a week, 10 days, and then decide if you want to add a volume.
Absolutely.
So this was a really difficult case because he's a middle-aged guy. He's 51 or 52, and he's a captain. So he's always at high altitude flying. So his photo damage, the skin damage, skin around the eyes was really damaged. So Shireen, how would you approach such type of a patient?
So again, a lot of hollowness, a lot of tissue loss, bone resorption. So I guess we should begin with a temporal strengthening. Definitely, there must be a little temporal fossa hollowing over there because that would improve the cheek sagging also, and also the nasojugal groove that he has. And again, the zygomatic ligament support. So the treatment approach remains the same using, I think he will, and his mid-cheek deflation is not as much. So we can do away with that treatment. So I guess it's the support on the lateral side and refinement with Restylane should do the trick for him. And advise post-care use of sunscreen and retinol.
Yes, so for him, I started because his skin was super sensitive. So I needed to calm down his skin with proper moisturizer and good sunscreen and a night repair cream. And his skin would literally fold in if you try to pull it up. So there was loss of collagen. So I worked on the mid cheek and on the lateral part of the cheek. So to give a tightened look and give a support to the cheek so that there is a collagen building and there is a tightness and firmness to the skin. And after correcting the cheeks, corrected the lateral part of the cheek, and then I came to the center around the eyes where I did the Restylane, and I added in this different skin boosters to improve the quality of the skin, because skin was getting dehydrated every time. Even if I did the volume correction, the skin was like, it's just, there's no hydration. So I had to add skin boosters to that, and it made a lot of difference. And the results which I'll be showing, it's almost after 2 sessions, which are done almost 8 months apart.
Okay.
And
So
for
the
him, I
skin
cannot do
boosters,
these, or
how often do you do the skin boosters for them?
see if it's the patient's time is also very important, because if they have pricks and all that, at least 2 to 3 days they have to be avoiding any meetings or this. So I usually, if I'm planning Vital, I do 3 sessions, like 4 to 6 weeks apart. So do 3 sessions, and then give a gap of at least 8 months, and then again repeat 2 sessions, like 6 weeks apart. So it gives you a good hydrated look. But in his case, I did 6 months because he was flying and he couldn't make it. But still, it made a lot of difference. And yeah, it improved his quality of the skin, so that the dehydrated and the he used to all every time had a burning sensation. So that all went away with good hyaluronic, like and collagen building inside.
Absolutely. Fantastic results. I mean, it's a transformation.
Yeah. So
Okay, so I guess, yeah, this is the case which I had done a couple of years ago. And she was a 42-year-old woman with very, very prominent under eye bags. I mean, her other complaints were not as, disturbing, as she was just very bogged down with these bags. And so I decided to do, and the skin quality around in the periorbital area was also not good, as in the skin was thin, and there was shadowing of the underlying vessels over there. So I handled this case. First, immediately we had to take up filler treatment for her. So with the same lateral and the refinement approach, I did that. And later on followed with platelet-rich plasma treatments for her periorbital area. And a month later, we achieved a good result. We can have the after pic. So this was a month later, where there is a very good reduction in her nasolabial folds. The under eye, the puffiness has been effaced, and still she had little nasojugal groove, which was addressed later on in the further sessions. So we achieved good amount of lifting, and overall, her main concern was the puffiness, which was addressed using fillers. So this is how I handled her.
beautiful, beautiful.
Yes, so that brings us to the end of the case studies, and we have 15 minutes with us for this session. What I would suggest now for our attendees to please share your questions for the doctors in the chat box. In the meanwhile, Dr. Shireen and Dr. Kiran, you all could have your open discussion as well. And simultaneously, we could also refer to the chat box for any questions that, come in. We already see there are a couple of questions. There are 3 questions already. If you all want to just, refer to it in the chat box and start responding, and simultaneously have your discussion as well.
Okay, so there's a question for treating periorbital hollowness. What is the exact injecting area if we want to be on a safer side? So for periorbital hollowness, as we have discussed, that we usually like to go for a full face approach. I think Kiran will agree with me, because as we have discussed, the lateral strengthening of the ligaments and supporting them is very important to cover to correct the periorbital area. So the exact area of injecting, if there is temporal hollowness, we correct the hollowness. If there is, loss of bone here, the malar eminence and all that, so we support the ligament. And finally, we refine it. So when we do these lateral points, we see a lot of change. I mean, almost 40 to 50% reduction in the hollowness and the nasojugal groove in particular. And then we can handle tear troughs as a final session with refinement using the OBT technology. So Kiran, would you like to add something to this?
Yeah, I think she is asking where exactly you need to inject. So when I am doing a tear trough, I would always do the markings like mid-pupillary line and the lateral pupillary line, and I'll make sure that I don't go beyond the mid-pupillary line, the middle pupillary line, because your infraorbital is just next to medial to that. So I always do the markings. So the line from the zygomatic, from the tragus to the lateral part of the nose, ala of the nose, and then this the lateral canthus of the eye, I drop it. So that will be the highest cheek point of your the cheek correction, and then you come medially and you do the lateral pupillary line and treat the lateral pupillary line. So half of your the nasojugal groove gets corrected with that, and then you can make a point between the lateral pupillary and the mid pupillary line, a little near to the tear trough, and inject a bolus of 0.1. So that will treat further. And if you want to further treat the medial part of the tear trough, I think you should go with a direct approach with the needle on the tear trough, like a small boluses, 2 boluses would be okay. And every time when you're injecting, always aspirate on the bone, count 10, and then inject, even if you are sure that you're on the bone. And if you are not comfortable on near the medial part, so you can take a cannula approach, go from the cheek and enter, and you can always adjust. But be while taking cannula, you have to always keep in mind your plane gets changed. So you have to be very slow moving, always aspirating and putting products very little amount, molding it, and do always under correction, because you might have surprises later on.
So I would like to add something to this. When we are working with cannula, one good approach that I have seen is like when we do a push test, when we want to test the strength of the tear trough ligament, because that is something which is pulling the skin down, you know. So we use a cannula and we kind of, do a little subcision with the cannula to break the fibrotic bonds, to release the ligament, and then we deposit a very, very small amount of filler, very medially if the tear trough is running very deep here. So that is also one good approach. And we can also fill up the restore space if there is a premaxillary space and a deeper is a restore space. So if the tear trough is very, very severe and medial, these are the two things which we can do using the cannula. And as Dr. Kiran said, we have to stay maximum, we have to stay lateral to the mid-pupillary line to be safe. For newer injectors, I think that would be good. And you have to develop the habit to use cannula ASAP. Because that gives at least some sense of security. We know that we are not directly in the artery. There is risk everywhere, but definitely the risk is lesser medially with a cannula.
We can move on to the next question.
Kiran, I would like to ask, what is your choice? What do you use more often? Is it a needle or a cannula? And if you're using the cannula, then what is the gauge that you prefer?
I always use 25 gauge, and I have done combination. If I have seen there is a good support of the tissue surrounding, so if I have to just treat the tear trough, I have done with the needle, and it's given excellent result. But in some patients there are laxity, and there is eye bags, and then there is the skin quality is not. So that time I have gone with the cannula to improve and put the product in layers so that I improve superficially the skin quality also, and deeper improve the strengthening of the teardrop. So the combination is better. In lateral part, I always inject on the bone, and medially, if there is a lot of bigger area to be treated, so I'll go with a cannula.
Okay. And what will be the entry point for the cannula when you're trying to treat the teardrop?
So again, lateral to the lateral pupillary line, take a point on the cheek only. So between the tragus and the on the same line, and you can directly go and enter the tear tip area. You can start from the mid cheek, inject, and then you go medially, put just below the mid pupillary line, and then you approach the medial part of the teardrop.
So are we doing an anterograde or a retrograde injection with the cannula?
Retrograde.
Okay, perfect. Thanks. So moving on to the next question, how many sessions are required to treat teardrop? Kiran, would you like to take this?
Yeah, for one session would be very less. Like we also don't want to overcorrect, and the patient is also scared for the session. So I always advise do one session, wait for 15-20 days, and take a second session. Maybe you can keep the same product, or you can wait, and if the product use is less, like 1 ml, it's not enough for the teardrop. So you might add 1 ml extra after a month. So I think 2 sessions are good enough to give you achievable, desirable results.
Yeah, and I guess this will also give a long-lasting result because
Yes.
the skin also gets enough hydration with hyaluronic acid. Great. So what technique of PRP is used for periorbital? So I inject directly into the skin 1 centimeter apart, and very superficial intradermal injections are placed. This is how PRP is injected. I don't use the mesotherapy or the derma roller because, you know, the skin is very thin. It can cause a lot of bruising, and directly placing intradermal injection means we are delivering 100% PRP into the skin. So the collagen remodeling is very good. So I avoid the derma roller. You know, I don't use any needling devices around the eyes just for the fear of bruising, because the bruisings can last very long. They take almost 7 to 10 days to disappear, and the patients don't like it. And PRP also, while injecting, there is a chance of bruising, but it is minimum because we use AccuVein device to, you know, to mark the veins and all. So they really guide us well. Okay. And Dr. Kiran, do you use a double layer approach when there is a mid-cheek loss? So would you like to elaborate on that, where using a NASHA product, we you know, kind of fill up the deep fat pads and then use the OBT for the superficial injection?
Yeah, so when we are correcting mid cheek, always you will use a volume and defined. Yeah, and sometimes if there is a heavy face and you want to give a lift, you can use Restylane lift, and you place superficially the Restylane to give the strengthening to the skin and improving the quality of the skin. So obviously the combination will work better than a single product.
And what are the risk of side effects have you experienced in this area? I mean, any vascular occlusion or any unfortunate incident that you have come across?
That's what till now I didn't get a periorbital or related thing, but when we do a teardrop, usually the Tyndall effect is the one of the side effect which we experience, and I think some may get with the same amount you inject and some may not get. So it really depends upon the quality of the skin, the complexion of the person, the vascularity in that area, because sometimes you put the product and the the lymphatic drainage in that area gets, so you tend to have that dilated veins in that area, and the tear trough you may not experience immediately, but in some patients you may, the Tyndall effect is seen after
Yes.
8 to 8 weeks later. So
Yes.
that can be quite disturbing. But I've still managed to highlight it and treat it to get. But then tear trough is something which it's a difficult in all the patients. Like you cannot, you have to be very judicious while using, selecting the product and
Products, right.
inject the amount.
Yes.
Yeah.
Absolutely. The product really matters because Tyndall totally depends on the product, because if it's placed very superficially, then definitely Tyndall happens, and it can be very distressing because they have come to us for periorbital darkness and we induce more darkness, you know. So that is something which everyone has to be very careful about. And staying away, as Dr. Kiran very rightly mentioned, staying lateral to the mid-pupillary line if you want to be safe, and using this good combination. We'll take the next question. How do you approach hollowness in lateral side of tear trough? I think Dr. Kiran already explained that laterally it always has to be on the bone, right, with aspiration. So,
And you get simple and you get excellent result.
Yes. And what will be the volume of the product that you use in the lateral side?
See, if it's more, it's usually either 2 point or 3 points will be needed for the lateral correction, and each point 0.05 is, I think, good enough to
Absolutely.
give
Yes.
the correction.
So are there any risk of any vascularity here, or we can be like we can definitely aspirate, but
yeah, I recently last week only had 2 positive aspirates on the lateral side.
wow.
You always think it's like a safer thing,
Yes.
but I did 1 point, I got a positive aspirate. The next point I also took, I got a positive. So
Okay.
I changed my needle approach and then I injected. So you cannot say the lateral part is like safe and you can still get. So always to be on the safer side.
Aspirate.
Be on
Yes.
bones, wait, aspirate, wait, again, then inject slowly.
Very true. Thank you. And can skin booster be injected in a superficial periorbital area in same sitting? Would you like to take this question?
Yeah, if you're placing it properly, because with Pital you need to know the proper depth of the placement and the amount we are injecting. You cannot put a lot of product, like small aliquots will improve the quality of the skin.
And do we have to massage Vital immediately? Because is there any chances of lumping over there?
Yeah, usually even if the lumps are there, if you've not placed it properly, they can last longer. If you have placed it and you're just seeing the bulb, it will go away in 48 hours for sure.
Okay. And bruising is something which we always have to keep in mind. So I guess we should advise the patients, we should always take history, whether they are on any medications like aspirin or vitamin C, vitamin E, green tea. This history should always be elicited before taking up the procedure. We should stop it in advance, you know, a couple of days. Right. And since we were discussing the side effects, would you also want to elaborate a little bit for our viewers and our attendees on hyaluronidase? I guess before we take up any filler treatment, we should have hyaluronidase in our clinic. It's a must. And all of us should know how to use hyaluronidase when needed, how to flush the area. So Kiran, would you want to elaborate on this?
See, again, depending upon when you're highlighting small amount of product, like if you want to remove the Tyndall or the lip or anywhere you want to hold it. So I usually, in the one vial, I add 1 ml of normal saline and I take 2 units of it and again reconstitute with, make it 10 units with the normal saline. And sometimes I take 1 unit of the diluted hyaluronidase and make it 12 units, so that there's a super dilute, and you can just use little aliquots around the on the tyndall, and because if you add more, the product goes away, and then again you have a complete teardrop
Hollowness, yes.
you have to be very, obviously you can highlight it in the second time also, so use very little and superficially, so that your purpose is also achieved and if their product is also not lost. So
Absolutely.
and if you have a vascular thing, definitely you need to flush the area irrespective of wherever you injected. So in and around that area, you have to just keep flushing it till you get a proper capillary filling up. So you have to do that and observe, and that's again a totally different chapter to be discussed.
Yes, very true. And this was a very important point which all of us should know, how to use Hylaze. And please explain the solution for Hylaze. So I guess Dr. Kiran has explained it very well, but I would just repeat it, that in a vial, we dilute it in 1 ml normal saline. And depending on the indication, depending on how many units, so if you are seeing any blanching and all that, so I guess we should use a more concentrated Hylaze. But if it's just for Tyndall, then even that 1 or 2 units of Hylaze, the concentrated solution, we can dilute it again 10 times more, and then inject in micro aliquots intradermally to take care of Tyndall. So I guess that explains it. If it's not an urgency, then sensitivity test for Hylaze has to be done. Dr. Kiran?
I usually take a proper history if there have been allergies.
Yeah, so even I don't do.
I've not yet done, and till now I've not gotten.
Yeah. Okay. What plane are we injecting in while using a cannula? So if we are doing the subcision for the tear trough ligament, then we are just in the ligament, but otherwise it's on the bone. So we want to inject the product on
the subcutaneous plane.
Yeah, subcutaneous or periosteum. Yeah, try to be on the periosteum or the subcutaneous plane, not intradermally. So I guess we have covered all the questions so far, and we have kind of discussed cases and taken care of most of the points which this area, all the indications and all the approaches which should be done to address tear trough and periorbital hollowness. So over to you, Shreyal.
Yes, thank you, Dr. Kiran, and thank you, Dr. Shireen. I think it was a very informative and engaging session, especially with, I think, the kind of cases that you all brought to the forefront. Although, you know, each case had its own unique thing, and the way you all even outlined it right from the age to the requirement and your approach, a lot of different treatments being put to use basis the cases. I think it was absolutely a 360-degree approach of content that we've got in this webinar. So thank you so much once again for all the time and giving us such insights. So for our attendees, this brings us to the end of today's webinar on Bright Eyes with Restylane. The webinar was organized by Aesthetic Medicine India and powered by Galderma. I would once again like to thank Dr. Kiran Hebalkar and Dr. Shireen Bhai Poonawala for being a part of this webinar and sharing such great insights. It was indeed a pleasure hearing from both of you. Our partner Galderma, thank you for all the support. I would also like to thank the viewers for your support and presence at the webinar today and those questions which equally made you part of the discussion. As we come to the end of this evening, here's looking forward to positive, safe times ahead for all of us. Once again, thank you. Have a lovely evening, and we will be seeing you soon with our next episode, episode 5 on the Let's Talk series. Till then, take care, stay safe, and have great times ahead. Thank you.
Thank you very much.
Thank you so much. Bye.
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 Thank you.